All right, Danny, you should have permission.
All right, give me one moment. Are you able to see my screen?
Not yet, Danny.
No?
Not yet.
Sorry about that. Give me 1 second. Right. My apologies. Sorry about that. I'm having a little technical difficulties. Um,
Here, Danny, I'll share the screen for you, and that way you can talk over your presentation. Let me just share it right now.
Sure.
Hold on 1 second.
Thank you.
Yep, just bear with me 1 second. There we go.
Amazing. Awesome. Thank you very much for that. All right. So welcome, everyone. Thank you for taking the time to meet with us today. I'm really excited to be here and talk to you guys about the PACE program, which stands for Program for All-Inclusive Care for the Elderly. Now, we're a model of care that's really specifically designed for seniors who require assistance at home with their day-to-day activities. Now, our mission at Centerlight is to ensure that our participants have the opportunity to live in their homes and to be a part of their communities for as long as possible, while also ensuring that they're happy, but most importantly, safe. And the way that we accomplish our mission is with the help of our interdisciplinary team, or IDT as we call it, which is a team of professionals that are on site every day to assist our participants and to discuss the care that each of our participants receive. Interdisciplinary is another way of saying working together, and that's exactly what this team does to provide the utmost care that our participants need. My colleague Stephanie Louie, who is one of our clinical service directors, will give you more insight into the IDT team right after this portion. All right, can we move to the next slide, please? Thank you. Beautiful. All right. So the PACE program is actually a site-based plan, meaning that our participants can use not only our services, but also have access to our facilities as well. Our centers are both a clinical hub, meaning we have doctors, nurses, and clinicians on site, and a social hub, meaning we also provide a social adult daycare center with programs and services designed for senior citizens. We can provide a home attendant to come in the morning to help your loved ones get ready to come to our site. We provide transportation to and from our sites, as well as all medical appointments. Now, I know that some of you may already be aware of the transportation services and maybe getting them through Access-a-Ride. But I do want to take this time to point out that with us, you'll be receiving a car service that'll take you directly from your house to your appointment. And once your appointment is done, directly take you from your appointment back to your house. For those who have been in an Access-a-Ride van, I'm pretty sure you guys have had experiences where you guys are waiting in the car for a very long time. So that it completely eliminates that wait time with us. There's also daily activities for our seniors at the sites, such as dancing, sing-alongs, yoga classes, music lessons, arts and crafts, and many more activities that'll keep our seniors both engaged and stimulated. We provide breakfast and lunch to all participants, and even a take-home dinner for those who may not have someone to cook for them at home. They can come to our site, have fun and enjoy time with their friends while getting their physical therapy done right next door in our clinic. We also have a doctor on site in case your loved one is not feeling well. Our doctors can assess them very quickly without a long wait in the waiting room and take the steps necessary to ensure your loved ones are safe and sound. We even have monthly trips for the seniors to the, botanical gardens. They go out to local restaurants for lunch, and they've even gone to the World Resort casinos in the past as well. So this is really an amazing opportunity for your loved ones to go out, kick back, and have some much needed fun. Once they're done for the day at our site, we'll provide transportation for the ride back home, and the home attendant can meet your loved ones back at home so they'll have someone looking after them throughout all hours of the day. Now, this is a huge benefit because many of you have full-time jobs, and it really may be concerning to leave your loved ones at home with no assistance. All right, next slide, please. So all of these services that I just explained are designed not only to benefit our participants physically and mentally, but it's also to give you caregivers such as yourselves some well-deserved peace of mind. I actually care for my father as well, so I understand how difficult it can be to focus on anything, especially those days when our loved ones are not doing so well. So, I hope it's a reassurance when we say that our staff are ready and willing to help you and your loved ones out. So to help you kind of get some peace of mind, rest assured that you'll have a team of professionals who are there to assist you and your loved ones around the clock. You'll receive door-to-door transportation, which means that they'll pick your loved ones up from the front door, and after the appointment, drop them off at the front door. And your loved ones will also receive home care and a wide range of at-home services, all the way from medication management to medical equipment installations like shower grab bars and things like that. Also, as a Centerlight participant, your loved ones will have access to our warm and welcoming centers, which are excellent for socializing. Next slide, please. So all of our participants have a designated participant experience manager who will provide a concierge service to your loved ones. They'll be greeting your loved ones when they join. They'll be hand delivering ID cards and OTC cards after enrollment, and they'll be your point of contact for any and all issues that you guys may experience. They'll be around friends and staff that are dedicated to helping them throughout the entire day. You'll have constant communication from the interdisciplinary team so that you're never left in the dark about your loved one's cares. And last but certainly not least, we work very closely with Premier Home Care to provide you with the CD Pass option, where a family or a friend can provide home care to your loved ones and get paid to do so. This is an amazing program, especially now during these difficult times as many people in our communities are losing their jobs. Megan and Joe from Premier will provide you with all the information you need on the CD Pass program shortly. And lastly, all of our participants have access to an amazing ambulance service called Assist Ambulance. If your loved ones are not feeling well, or if there's an incident such as a fall, Centerlight participants have the option to call Assist Ambulance, who'll send an EMT directly to the homes and treat them right then and there. So the reason why this is so great is because it's going to prevent any unnecessary hospital visits, potentially exposing you to COVID-19. So next slide, please. Thank you. So if you look here, these are some of the services that the EMTs can provide at the house. And if further medical treatment is required or the injury is severe, they'll take your loved ones directly to the hospital without hesitation. Next slide, please. All right, so you're probably asking yourself where our centers are now. We have a total of 12 full-pay centers with doctors, nurses, and physical therapists. and 2 alternate care settings that are solely focused on the social adult day care aspect. We have an extensive coverage area to ensure that you're never too far away from a Centerlight PACE center. We cover all 5 boroughs, along with Westchester, Nassau, and Suffolk County. And if you'd like for me to check if your loved ones reside within our coverage area, please reach out to me after the workshop and I'll gladly check that information for you. Next slide, please. Awesome. All right, so now, as wonderful as it will be for everyone to be able to join the PACE program, there are some qualifications that need to be met. The first is that you must be 55 years of age or older. You must be residing within our coverage area. You must need assistance with your daily living activities, such as getting dressed, eating, or food shopping, things of that nature. And in terms of Medicaid and Medicare, all you need to enroll with us is Medicaid. If you do not have Medicaid, we assist with all Medicaid applications. We'll help you fill the application out and collect all necessary documents. Once completed, our Medicaid specialist will hand deliver the application directly to the Medicaid office. If you don't qualify for Medicaid due to income, we work very closely with Mark from SCS Pool Trust, who will be giving a fantastic overview of the Pooled Income Trust program in just a bit. Next slide, please. Great. So the key difference that makes us stand out in the market is really how in-depth and hands-on our approach really is. And at